Very good afternoon. Today we are going to learn about lymphedema. We all know that what is lymphedema. We all know it's a lymphedema. Can you take care of the patients? So this is one of the major topic in palliative care because we should know what is lymphedema and how to take care of patient with lymphedema. So today we have Sister Sreedevi with us. She is our section head of our inpatient unit, and she has around 10 years of experience in palliative care. She did her certificate course in palliative nursing from Pallium, India. So she is a well-versed person in this field. Sreedevi, welcome and over to you. Thank you.
Good afternoon, all. Today we are discussing about lymphedema and its management. First of all, we start with lymph and lymphatic system. I think all of you know and familiar with lymphatic system. Anybody tell about lymph or lymphatic system? What is lymph? Any of you can answer. All nurses will know about lymphatic system and what is lymph. So we can start with lymph. So anybody? What is lymph?
Please respond.
You can chat.
So we need to understand about your insight about lymphatic system. So just we should know what is your concept and what you are thinking about lymphedema, what is lymph and all. So please unmute yourself and talk, or you can put your answers in the chat.
Okay, filtering work. Okay. Other than that, enlarged glands. I mean, what is lymph? Okay. Drain excess fluid, exactly. Okay, interstitial fluid, uh, lymphatic blockages. Yeah. Yeah. What is lymph? Lymph means it is an interstitial fluid that enters into the lymphatic vessels. We know that in our body, in a human body, there is a sort of interstitial fluid in all over the body. That interstitial fluid enters into specialized vessels called lymphatic vessels. That time, this interstitial fluid is called as lymph. Okay. So lymph also interstitial fluid. So it enters into the lymphatic vessel, then it called as lymphatic fluid or lymph. So what are the functions of lymphatic system? Any one function? Anybody? Already one function is discussed by one of you. Filtering work. What are the things will be filtering through the lymphatic system? Immune response, lymphatic vessel obstruction, transport of dietary lipids, okay, lymphatic blockage, So reabsorb excess interstitial fluid. It absorbs the excess interstitial fluid from our body, and it will maintain an equilibrium between the body fluids. So it will cause sometimes maybe cardiac diseases and all. There is a lot of interstitial fluid will be accumulated in the pericardium and all. So it will cause the cardiac issues. Next one is transport of dietary lipids and lymphocyte development and the immune response. Lymphocyte is nothing but it is as a part of immune response. Some sort of cells are developed in that time. It is called as lymphocyte development. So in infection and inflammation timing, there is a variation in lymphocytes. So it indicates the there is some infection is developed in our body. So it is a immune response, is a part of immune response. Anybody can explain about systemic circulation of our body in simple words? This is a complicated one, I know. So anybody can please explain the systemic circulation of our body. What happens in our body during the systemic circulation? Systemic circulation is nothing but it is the gas exchange as well as the blood circulation. It happens in our body. It contains lungs, heart, and some blood vessels. So from our body part, upper part of the body, superior vena cava collect the impure blood from the upper part of the body to the lungs, and inferior vena cava will collect the impure blood from the lower part of the body. Uh, it will enters into the lungs and happens purification process. From there, pulmonary veins carry the pure blood to the atrium. So from there, ventricle it will go and through this from aorta carry the pure blood to the all over the body parts. It is the systemic circulation in simple words. There is a so much of process has been taken place in that process. This is the systemic circulation happens in our body. During this process, some sort of fluid will be leaking through venous system and arterial system communication. That time some sort of fluid will be leaking from that area. It will enters into the some sort of specialist vessels that is called as lymph or lymphatic system. In picture you can see some green colored vessels are there. That is called small capillaries. That is called as lymph capillaries. During the communication of venous system and arterial system, that is a large vessel. From there, the leaking of some interstitial fluids that will carried by the capillaries called lymph capillaries. It is called as lymph fluid and lymphatic. It enters into the lymphatic vessels and collected to the lymph trunk, and at last it excreted through the kidneys. This is the anatomy of lymphatic system. It shows all over the body that the lymphatic system present. Through this channel, the lymph fluid is circulating throughout the body. Anybody know what is this? What is this condition?
Filariasis.
Filariasis. Other than that,
Cellulitis.
Lymphedema.
Lymphedema. So our topic is lymphedema. What is lymphedema means? It is a swelling of interstitial tissue as a result of lymph drainage failure when capillary filtration is in normal. When the capillary filtration, the process of producing fluid is taken place, that time the flow of lymphatic drainage is disturbed. Due to this, that fluid will be accumulated throughout the lymph. That is called as lymphedema. That is nothing but lymph drainage failure when capillary filtration is in normal. So that will cause the interstitial tissue swelling. That is called lymphedema. For lymphedema, there is mainly two classification is there. First one is primary and second one is secondary. Primary means in a congenital lymphatic dysplasia means in congenital, that is in birth itself, the patient may or person may have some disturbance in the lymph system drainage. So that will cause the lymphatic disturbance and causing the lymphedema. That is called primary. Primary means congenital. Secondary means anatomical obliteration of lymphatic system. During the life period, there is some chance of getting some anatomical disturbance in the lymphatic system. It will cause the accumulation of lymph fluid through that area. It is called as secondary. In secondary, there are some classification is there, malignant and non-malignant. Malignant means all of you know some cancer related things are malignant, primary. Sometimes patient may get developed the malignant tumors in the lymphatic system. That is called primary lymphomas. And secondary means recurrence. Sometimes patient may get cancer or malignant tumors in the one part that will spread throughout the surrounding lymph nodes. That is called secondary. And second type is in secondary lymphedema, non-malignant. That is nothing but something related to trauma. During the road traffic accident or burns and all, there is a chance of getting damage of the lymphatic system. That will cause lymphatic system drainage blockage and it will cause the lymphedema. Second one is infection. Already we said that cellulitis. So it is a complication of lymphedema. During the lymphedema management there is a chance of getting cellulitis. So then next is iatrogenic, something related to treatment. That is iatrogenic. Maybe sometimes surgery time and there is a chance of removal of surrounding lymph nodes also. You know that some vasectomy patients and the surrounding lymph nodes also removed by the time of total mastectomy. So there is chance of getting lymphatic drainage blockage and it will cause the lymphedema. Then radiotherapy. During the radiotherapy sections and the surrounding lymph nodes also affected. So high density light will be given to that area. It will affect the surrounding normal lymph nodes also. It also causing lymphatic drainage blockage. Then implication. What are the implications of lymphedema? There are some implications in every disease conditions for the patient. It will affect the patient in different ways. First one is physical. In physical, in lymphedema patients, did you know have any lymphedema patients in your setting? Anybody?
See a breast patient, after the surgery they get lymphedema.
What are the main physical problems of that patients, ma'am?
Pain.
Pain, discomfort, impaired mobility, and loss of
Swelling,
function.
heaviness.
Other than that, pain will be there. Due to pain, there is some discomfort is there. Already tell that heaviness will be there. The huge edema means there is a more weight due to this edema. That is heaviness. That will affect the mobility. So impaired mobility will be there. Then loss of function. Due to the impaired mobility, the affected person can't do anything with that help of with that limbs. So it will affect the loss of function. These are the main physical implications for the lymphedema patient. So first one is discomfort and pain and impaired mobility and loss of function. These are the main physical symptoms. Other than that, any other symptoms, physical, other than?
Mental and spiritual.
Okay. Yeah, psychosocial, psychological implications are, first one is body image. So the huge edema will be there. With this huge edema, the person can approach any function or anybody because of some body image disturbance. So they think that others will think that it is a huge disease or something. It affected the psychosocial aspects also. So body image disturbance is the main psychosocial implication. Next one is function and work. Due to the pain and heaviness, the person can do any function or can't do their regular works. Then stigma. Stigma means how to face others in the society. So that is social stigma. Remainder of disease. Sometimes the person may think that the lymphedema may be due to the recurrence. That is, we already discussed that after the mastectomy or radiotherapy, doctor says that after the management you will be okay. So after 2 to 3 months, they develop the small edemas, and it will become huge after 6 to 1 year. So they think that already doctor said that the disease will gone, but this edema may be due to the recurrence of that disease. That is the remainder of disease. And anxiety and depression due to the social stigma and body image disturbance and difficulty to do the function or work. That is the anxiety. It will leads to the depression state. And financial constraints. Financial constraints means due to the during the management of lymphedema, there is a huge financial constraints will be there because of buying some for the bandages and sleeves and all. There is a very it will leads to financial constraint for the patient and family. So in physical, what are the changes in the skin? This is the skin changes in the lymphedema patients. The first one is shows orange peel skin. It's a like the covering of orange. No, our lymphedema patient skin will be in first stage and like this orange peel skin, and next stage it will develop some deep creases. If we are not treating the lymphedema in first stage and all, it will causing harden. It will become deep creases and skin will become thick and hard. These are the skin changes in the lymphedema. Next one is diagnosing the lymphedema. How to diagnose lymphedema? First, we take a proper history for the patient. Sometimes we can't recognize that is lymphedema or venous edema. So we have to check the proper history. While talking with the patient, take a proper history from there. Check the all records and reports available with them. Any scanning reports or anything is there, you have to go through that and confirm that is a lymphedema or other than that. So history collection is very important for diagnosing lymphedema. During collection of history, we have to check like some points in your mind, keeping in your mind, that is unknown cause. That is nothing but we have to collect the history during that time. You you take the history like any edema is causing without any reason. So unknown cause is there without any reason the edema is developed or not. Next one is disease or trauma. Any disease or trauma history is there for that affected lymph or affected area. That also we have to collect. Any treatment has been done. Sometimes the radiotherapy or surgery have to done previously. After that only the edema happens. So you have to take the proper history. Next one is clinical examination. In clinical examination, we already discussed regarding the skin changes and all. Just go through that and how the skin looks like. So that is the clinical examination. Other than that, how to diagnose the lymphedema? It is called pitting edema test. How to take the how to do the pitting edema test means in stage first and all, we have to apply a gentle pressure over the swollen tissue. It's a pitting edema means the marking of our pressure point, no, that can seen by our naked eye. So it is a pitting edema test we have to perform in the lymphedema patients. And this is performed in the first stage of lymphedema. So at the stage, the tissues are swollen but are still soft. So gentle pressure we can apply to the swollen tissue. It can be visible. The depression of the pressure area we can visible by naked eyes. In stage 2, the tissues have become fibrotic or hardened and the tissues are no longer soft. In stage first and all, the tissue will be very soft. In second stage, it will become more hardened than first stage. In stage 3, the tissues are considerably hardened and treatment may be able to prevent the swelling from becoming worse. However, it cannot reverse the damage that already occurred. In first stage is pitting edema means second stage is little bit hardened. In third stage, it is fibrotic and it is hardened more than second stage and deep creases will be there in the skin. Once it will be, however, it cannot be reversed the damage that already occurred. This is nothing but one of the confirmation tests we have to perform in the lower limb edemas. This is called Stemmer's sign. Stemmer's sign is nothing but it is a thickened fold of skin at the base of the second toe or second finger that cannot be gently pinched and lifted. In normally, we can lift the second toe skin easily without any edema. During the lymphedema stage, we can lift and pinch the second toe skin easily. So this is the Stemmer sign. Due to the accumulation of fluid in the interphalangeal spaces and all, it is very difficult to pinch out or lift at the skin during the lymphedema. So for what purpose we have taken measurement? This is the measurement measurement for lymphedema patients. We taken the proper lymphedema measurement for the patient before and after the management. For what purpose we have to doing the measurement for the patient with lymphedema? For any condition, for what purpose we taken the measurements? Stage. This is nothing but we have to identify the impact of our management. We have to do. We have to check the how to working our management. Any improvement is there or not. If we have to take the measurement every weekly or within 5 to 6 days. So we have to repeat the measurements every 5 days or every weekly wise. Because if we first take the measurement and noted in the measurement chart and give the management, some massaging, bandaging, something we have to do now. So after that, we have to check the measurement means any change in the management with the any change with massaging, any change with bandaging or stockings. So for that purpose, we have to take the measurement. Other than that, to prepare the stockings, how to prepare the stockings. So these two purpose, we have to check the measurement of the lymphedema. So for taking measurement, we give a comfortable position with the arm supported on the table. And how to check means number of centimeter from the head of ulna and or angle joint. After that, every 4 centimeter. First, we have to identify the ulna or angle joint and take the 2 centimeter above points circumference. First, you have to note the points first and take the measurement of the points, circumference of the that points. So first 2 centimeter above the ulna. From that point, every 4 centimeter up to the shoulder or up to the inguinal area. So that is the measurement. So what are the management we have to do for the lymphedema patient? First one is skin care. For skin care of the lymphedema patient is very important because there is a chance of getting infection and a very risk. So we have to take a proper skin care. In skin care, first one is dry skin. If the patient is having dry skin, so apply the oil or moisturizing cream. For what purpose we have applying oil or moisturizing cream? Means dry skin. What happened for dry skin?
Make crack.
Crack. Okay. For crack, once we get the crack, means what will happen for lymphedema patients?
Bleeding.
Bleeding. Oozing. Okay. Fluid oozing. Okay. It will if the dry skin means there is a chance of getting itching. Due to the itching, there is a small scratch will be there. Through this scratch mark, the fluid will be oozing. So oozing of this fluid may cause to wound formation for that area. Other than that, there is a portal of entry of microorganism to the body that will causing sometimes cellulitis, sometimes some systemic infection also there. So there is a chance of getting infection is very more in lymphedema patients. So we have to taken care of their skin. So tell them to taking care of skin properly. So we have to manage dry skin with the moisturizing cream application. Wash the area regularly. Meticulous drying between the digits. What is the important point in meticulous drying between the digit means? There is a chance of getting fungal infection. Sometimes we wash the area properly, but some sort of moist or water content will be remains in the between the digits. The dust and some particles will be accumulated in between the digits along with the this water content. It will causing the fungal infection to the affect that area. So meticulous drying between the digit is very important while taking the skin care. So other than that, apply simple moisturizing cream, avoid injections or venipuncture. So this is nothing but it will cause the when we prick to the affected skin means it will cause the fluid leakage will be there that will cause the infection. Avoid waxing waxing or razor, avoid blood pressure cuffs to the affected limb, avoid injury. These are the other points to be remember in the skincare of the lymphedema patient. As a nurse, we have to take the proper history timing and all, check that area properly, and don't do any nursing procedure to the affected limb other than that lymphedema management. This is the second principle of lymphedema management. First one is skincare, we already discussed. Second one is massaging. In this, there is a two types of massaging is there. First one is simple lymphatic massage. This is nothing but anybody can do the massage to the lymphedema hand. Simple stimulation stimulate the contractions of the superficial skin lymphatics. This is called as simple lymphatic massage. We can give a simple massage to the affected limb with the normal pressure. It will help the fluid to move congested area to the non-congested areas. So this is the simple lymphatic massage. Anybody can perform. Anybody means the family member or untrained person can train the simple lymphatic massage as a management of the lymphedema. So next one is first one is simple lymphatic massage, and second one is manual lymphatic drainage or manual lymphatic massage. It is nothing but the trained person can be do the manual lymphatic drainage. It is started with the deep diaphragmatic breathing. What is the indication of deep diaphragmatic breathing? We can do the manual lymphatic drainage. The trained nurse can perform the manual lymphatic drainage. So as a part of that, we have to start with the deep breathing exercise. What is that? What do you mean by deep diaphragmatic breathing? Or what is the indication of that breathing? Anybody?
Release the stress.
Release the stress. Other than that, in lymphedema,
Relieve the
Drainage, better drainage.
better drainage. Exactly, that is while we doing a deep diaphragmatic breathing, it will stimulate the abdominal lymph nodes also. The in diaphragm area there is a stimulation will be there. The abdominal lymph nodes also stimulate while doing deep breathing exercise. So while we have to check stimulate the lymph nodes means after massaging the fluid will be enters into the lymphatic system. It will drain properly with the help of the stimulating lymph nodes in all over the body. So that's why we take a deep breathing to stimulating the abdominal lymph nodes. So second one is stimulate the unaffected nodes. We do the massaging to the affected limb. So we have to stimulate the nodes of the unaffected lymph nodes, because once we massage the affected area means it will transferring the fluid to congested area to the non-congested area, no. So that time we have to stimulate the nodes in the unaffected area. It will ready to pick the fluid from the massaging time. So that's why we have to stimulate the unaffected node first. Massage from the distal to the proximal. If the patient is having lymphedema in the upper limb means we have to, the distal area will be the fingers. So we have to start with the fingers, then go through the shoulder area. So that is massage from the distal to proximal. In case of upper limbs, we have to start the massage from the fingers to the shoulders. In lower limb means from the phalanges to the thigh region. So that is the method of massaging. Use gentle pressure. There is a hard pressure is not needed for the massaging time because the lymphatic vessels are distributed peripherally to the superficial to the skin. So there is a simple massage is there. So simple pressure, gentle pressure is needed for transferring the fluid. So these are the main things in the manual lymphatic drainage. As a nurse or as an instructor, we have to keep in mind these points. Start with the deep diaphragmatic breathing, stimulate the unaffected node, and massage from the distal to the proximal area. Use a gentle pressure. These are the 4 points keep in mind during doing the lymphatic drainage. These are the things we needed for the lymphatic system massaging and bandaging time. So these are things we used for bandaging. First one is biolin is there. Different type of bandages is there. And cotton padding will be there. Physio ball is there. And my paper plaster. We don't place the bandages with the clips because it may cause the skin injury. So avoid the clips available with the bandages for securing the bandage. So use the paper plaster or micropore for the placing the bandage in situ. And after bandaging, next principle is exercise. For what purpose we are doing exercise means it will stimulate the lymph fluid drainage. So for that we have to do gentle and regular exercise we can perform to the affected hand. Next one is wearing compression sleeve. Compression sleeve is nothing but we can customized one can be purchased from the surgical center. So that is same effect of bandages. So wearing compression sleeve will be there before doing exercise, and it is doing means preventing stiffness. To avoid the stiffness, we have to perform the exercise after the massaging and bandaging. It will stimulate the or encouraging the normal activity of the person. It will improve the range of motion and we have to perform the passive and active exercises for the patients. We can sometimes the huge edema is there means the patient can't do any exercise with this huge edema. Along with this edema, we have to perform the bandage. No, that also very weight. So with the help of others only they can perform the some exercises. So we can educate the family member regarding the management and exercise after discharging or after the home visit for continuing the care. This is the one of the complication of lymphedema. This is called lymphoria. Anybody know lymphoria? What is lymphoria? Lymphoria means it's a leakage of fluid from the lymphedema site. So occur as a result of trauma to the skin of swollen limb. There will be a leakage of fluid through the broken skin. It is called as lymphoria. It is nothing but crying the lymph. So tears of lymph is called as lymphoria. And the treatment is nothing but apply non-adherent dressing to the leaking area. So some sort of pressure applied to the lymphoria site and give a tight bandaging to that area to stop the leakage of fluid. Apply pressure bandaging. Next complication is cellulitis. Cellulitis, what are the difference between cellulitis and lymphoria? how we can differentiate the cellulitis? What are the signs of cellulitis? Anybody?
Swelling,
Swelling,
redness,
redness,
sinus,
yeah, redness will be there, edema will be there, temperature, local rise of temperature will be there, pain, severe pain will be there. Sometimes there is a skin peeling or chance of infection will be there in the cellulitis. So we are doing a lymphedema for a patient. In fastest 2-3 days, we have to monitor the skin closely. There is a chance of getting cellulitis is very common sometimes. So we have to check the skin properly. There is any skin change is there, you have to stop the lymphedema management and taking care of the patient with the proper management pattern. So already know there will be pain will be there, redness will be there, shiny skin, and temperature, local rise of temperature will be there. So we have to notify that and inform to the doctor and act immediately. Consult the doctor immediately. Stop massaging and compression or exercise. Any management we have to do means stop the management immediately and consult the doctor. Treatment is nothing but oral antibiotic is needed for the cellulitis patient. In starting stage and all, we have to start with oral antibiotics. If the patient is having severe infection means we have to start with the IV parenteral antibiotics, and for pain we have to start with the analgesics and give a proper rest and avoid bandaging, massaging, and exercises. So if the patient is having pain means pain only, there is no signs of cellulitis, there is some pain will be there means you have to taken care of pain first. So manage the pain first, then you do the lymphedema. If the patient is taking any pain medication means you give the pain medication half an hour before the lymphedema management. First settle the pain and go through the lymphedema management.
Thank you, Sreedevi, for the wonderful session. Anybody have any doubts on this? Please ask. So, Remini ma'am is asking magnesium sulfate is called compression. Max sulfate. Oh, max sulfate, glycerin max sulfate. Right? You are asking about
That is for
glycerin max
cellulitis.
sulfate. Cellulitis. Remini ma'am?
Yes, ma'am.
Yeah, what is your question?
No. For cellulitis patient, we can give Maxel cold compress to reduce the edema.
Okay.
Usually in diabetic patient gets cellulitis. For that, lymph elevation and Maxel cold compression, local application to reduce the swelling.
Okay, thank you. So, thank you. Usually, that will help in other patients like diabetic patient or patient and other patients. But in here is a cellulite, the lymphedema patient. No, sometimes it may not help. So, if the patient is having cellulitis in lymphedema, so better you can give an antibiotics. Antibiotics is the first line management of controlling cellulitis. So here there is a chance of major problem because there is no lymphocytes for that fighting the disease. So that is very important. If you have noticed these kind of signs and symptoms, please refer the patient to the physician and make sure that the patient is on antibiotics. So, but other patients, it might help. Some of the places are using Maxel, glycerin Maxel for controlling swelling, but if they have any, after that, after application, if you have seen any kind of distress, better you don't apply it again. You have to think about antibiotics. Thank you. Any other questions?
For preventing lymphedema, after the breast surgery and all, we can avoid giving injection to the affected area or then just
Yeah, so there are
tight clothes, avoiding the wearing the tight clothes, glass bangles, or any needle prick, or carrying heavy things can be avoided after surgery.
yes, that is also important. I think Sister Sreedevi was covering few things
Yes,
about
yes.
skincare part. That is
Prevention.
also yeah, that is also very important. If you take heavy weights, what happen? Others, please respond. If you take, we usually ask the patient to, you will ask the advise them to, you should not take heavy weights for your affected limb. Why? They might be asked
Because
this question.
after MRM, the lymph nodes are also removed.
Yeah, so there is no lymph node because where does the lymph origin? That we should understand. Wherever the the arterial capillaries and the venous capillaries are communicating together, there is a leakage of fluid-like substance into the interstitial space. Okay, that is called lymph. So wherever the arterial capillaries and the venous capillaries are communicating together, that we should understand. There is a chance of leaking of fluid-like substance into the interstitial space. So, if you take heavy weights, what happens? The blood circulation will increase, so that the edema also increase. So that is why we request them to not take heavy weights. If they take heavy weights, the edema will increase. Okay, so wherever the fluid leakage, then the lymphatic capillaries are ready to absorb the fluid from the interstitial space and it goes to the nodes, lymphatic vessels to lymph nodes. What is the major function of lymph node? That we should understand. The lymph node is there to filtering out the harmful substance from the lymphatic fluid. Finally, it goes to the subclavian vein. So that's why we said lymphatic system is a part of circulatory system. So if the sometimes the lymphatic fluids contains bacteria, virus, or other waste products. So the lymph nodes are ready to there to filtering out the harmful substance. That we should understand. So here, if a patient is underwent mastectomy, there is no lymph node. There is no lymph node fighting against the infections like bacteria, virus, or anything. So there is a chance of cellulitis. So that is why we need to educate the patient about skincare. That is very important. Any other questions? We have a video on lymphedema because we have two video. One is about manual lymphatic drainage. The management is two-way. One is manual lymphatic drainage and the another one is simple lymphatic drainage, that is the massage. So there are four principles: skin care, massage, bandaging, and exercise. These are the four principles of management of lymphedema. So after education, after educating the skincare part, you have to educate them about the massaging. So in massaging, again divided into two, simple lymphatic drainage and the manual lymphatic drainage. So simple lymphatic drainage is done by the patient or a caregiver. With the help of a caregiver, the patient can themselves do. That is simple lymphatic drainage. But the manual lymphatic drainage, we need a trained persons. We know how much pressure is. We professionals, nurses, physiotherapists, doctors should know how much pressure is needed for moving the fluid from one place to another. Okay, so we only gentle pressure is needed because the fluid is accumulated in the interstitial space. So if you apply more pressure, what happen? The blood circulation will increase, and that way the edema will increase. So the affected limb is touched only by the trained professionals. When they go home, you can, when the patient is in the inpatient unit, or when they come to the outpatient unit, you can teach them, you can do the manual lymphatic drainage, you can apply pressure on their affected limb, but when they go back, they should not touch the affected limb, but all other things they can do. They can take a deep breathing exercise, they can stimulate the superficial lymph nodes, they can stimulate the opposite side of the lymph nodes, and then they can where they can apply bandages and then again take a deep breathing exercise and then that exercise. So these are the then limb elevation. These are the things they can do. So now we are going to show the video on manual lymphatic drainage that should be done by a professional, trained professionals. Please watch this video and let us know if you have any doubts or any clarification needed. Thank you. Anybody have any doubts? Anybody have any doubts? So the idea behind this manual lymphatic drainage is there is a block there now. There is no lymph node into their affected limbs. We are pushing the fluid from the affected area to the non-affected area, the congested part to the non-congested part. The other parts, all lymph nodes are ready and they are healthy, and when you push the fluid from the affected side to the non-affected side, the other lymph nodes will uh, collect the extra fluid. So that is why we encourage to take the patient to take a deep breathing exercise, because it's around 600 to 700 lymph nodes in our body. So all lymph nodes will stimulated, and then so if you push fluid from the affected area to the non-affected area, all lymph nodes will take the extra fluid from the chest areas and all. So that is why we do the manual lymphatic drainage for the lymphedema patients. Okay, so because this is very good looking, very hard, because there are many steps. If you're definitely you need a hands-on experience for this, but why we are showing this video with you all is we have whenever you have seen a patient with lymphedema, you have to think about the management of lymphedema. If you have any institutions nearby, or maybe palliative care centers and NGOs are nearby there, please refer the patient to them for that better care. So they all know what is lymphedema, how to manage lymphedema. At least you have to refer the patient to them uh, for the treatment of management of lymphedema. Thank you. So I think we have one more video. After this manual lymphatic drainage, you have to do the bandaging. Initially, we will do the spiral bandaging. So after that, you have to check whether the patient is able to tolerate the spiral bandage. We know what is spiral bandage, that is 50% overlap. So then if the patient is tolerating that, then you can think about the figure of it, that is multi-layer bandaging. If you apply more pressure on that area, the fluid will move up. So that is why we prefer multi-layer bandages. Okay, so we can watch that video now and then take questions. So unfortunately, we don't have a case presentation today also. Anybody have any doubts on this presentation, please ask. So, thank you, ma'am. Okay. Any other questions? So, if you don't have any questions, we are going to wind up the session. So, in a nutshell, we should understand that what is lymphedema. Coming to the management part, we already discussed. There are many ways to manage, especially there are four principles: skin care, manual lymphatic drainage, and bandaging and exercise. These are the four principles of management, and also the stockings are available. Stockings, yeah. So we can use stockings, but they should, if they are using stockings, they should remove at night, because that is too much stretching. That elasticity is too high. If the edema comes down, that elasticity, the crepe, compression bandaging construct the tissues, and maybe that leads to that maybe the affected that part will not get adequate blood supply. It's better they should remove at night, and the morning then they should use. But the thing is, before using that sleeves, that stockings, you have to check whether the edema is uniform or not. If one area, like that means that proximal part, and you can divide it into two parts in the upper arm, proximal and distal part. If the distal area is too much edema and the proximal part is less edema, so that time you should not prefer, you should not advise the patient to wear stockings. If the edema is uniform, then you can advise that stockings. You can use slim sleeves also, ma'am. But if that is also very expensive, better you can use crepe bandages. Before applying crepe bandages, also you should that cover the area, the skin, with a thin layer of cotton roll. So maybe some of the patients become allergic with the crepe bandages, and we need to protect the skin also. So that you should keep it in mind, and also while doing the bandaging, you should not cover the fingernails. So we should understand that if there is any circulation environment there, we can check the fingernails, and from that we can understand. And you should not fix the bandages with metal clips. You always clip that use band-aid, that paper plaster micropore, because metal clip sometimes might be touch the crack on the affected area, affected in lymphedema, maybe that leads to the patient's goes to cellulitis. So better you should avoid the metal that clips. Always you have to use the micropore for fixing the bandages. So there are two major side effects, major complications of lymphedema. One is cellulitis, the another one is lymphoria. If the patient is having lymphoria is oozing out the fluid from the lymphedema site. If the patient is having lymphoria, then you can apply crepe bandages. There is no restriction, because we are going to that squeeze out the excess fluid from the lymphedema site. If you apply that crepe bandages for the same. But in case of cellulitis, the patients will have a pain and distress, because there are, we know if the patient is having cellulitis, pain, redness, irritations and all will be there. Better you can take, you can give a course of antibiotics and give a adequate analgesics management, and then once the pain become free, then you can think about the active management. Okay, so that is also you have to keep it in mind. So, ma'am is asking if oozing can be used. Yes, we can use the crepe bandages, ma'am, because that will help to drain the fluid from the lymphedema area, lymphedema sites. if there is any little cracks there, better you can apply a dressing pad over there, and then you can apply crepe bandages. For the finger bandaging, there are that small size scrub bandages are not available in the shops, medical shops. But what we do here is we used to take 6 centimeter that bandages and fold it into two, and then that bandage we used to use for finger bandages. Anti-inflammatory, yeah, if there is an inflammation there, definitely the patient will need an NSAID. You can give an NSAID along with antibiotics. But diuretics most of the time will not help much. Hope you all get a little idea about lymphedema. Thank you all. We can wind up the session today. If you have any questions, please put it in the groups also. We can able to answer your questions. Thank you all. The Sreedevi is left. Thank you, Sreedevi, for the wonderful session. Thank you others for your participation and your interactions. Thank you.
Thank you, Sreedevi, sister, for the wonderful presentation. Thank you, Siva, sister, for facilitating and clearing all the doubts of the participants. Thank you, participants, for the effective, active participations in these sessions. Thank you, and let's see in the next session. Bye.